Let's start with a topic that everybody's been talking about. The new coronavirus. What began in Chinese city of Wuhan in early December has now become a global health disaster. As the virus moved beyond China, so did the dread. If you are terrified in a way that the virus might infect you or your family, then we are all curious. Is this new virus contagious? What are the signs and symptoms? And how can we keep ourselves safe? So this is what we are dealing with. A virus they start calling the nCoV 2019. The N starts for novel, meaning new, and CoV stands for coronavirus. And this is what it looks like. First, let's get a sense of how we got here. It started with a viral blip, a few cases of pneumonia in Wuhan. Then doctors noticed that many of the people who were sick had a connection to a market that sold fish and wildlife. From there, virus spread from thousands of Chinese into millions of people in China. Then, the Chinese government were forced to put quarantine. Wuhan was locked down first. Flight has been cancelled. Airlines pulled flights, and trains stopped running. Schools and business were closed, and people were told to stay indoors. But it didn't stop the virus from spreading across countries, including the Philippines. So what do we know about coronavirus? COVID-19 most commonly produces respiratory symptoms that mimic cold, flu, or pneumonia. But it can also damage other areas of our body. The majority of people who get COVID-19 have moderate symptoms, but some become seriously sick. Then COVID-19 is more likely to cause serious sickness in older persons and people with specific underlying medical conditions. COVID-19 spreads when an individual or infected individual exhales virus containing droplets and extremely tiny particles. Other individuals may breathe in these droplets and particles, or they may settle on their eyes, nose, or mouths. In rare cases, they may contaminate the surface they come into contact with. People who are within 6 feet of an infected person are more likely to become infected. That is why our government imposed the social distancing to mitigate the coronavirus. So COVID-19 can disseminate in 3 ways. 1, breathing in air when near an infected person. 2, having coronavirus containing droplets and particles land on our eyes, our nose, or our mouth. Then lastly, touching the eyes, nose, or mouth with virus-infected hands. So how can we keep ourselves safe? Number 1, let's get vaccinated. COVID-19 vaccines are effective at keeping you from getting COVID-19, especially severe illness and death. Vaccines are safe, effective, and free. So once you are fully vaccinated, you may be able to do or to start doing the things that you had stopped doing because of the pandemic. Second, wear a mask. Wearing a mask, especially outside, will give you protection from COVID-19. Third, exercise social distancing. Fourth, avoid crowds. And lastly, wash your hands. So globally, as of 24th of September 2021, there have been 200,418,451 confirmed cases of COVID-19, including 4 million deaths reported to the World Health Organization. In the Philippines, there are 2 million confirmed cases and 37,000 confirmed deaths in the Philippines. So now that we know the basics, we may be able to help our government and to help our community to mitigate the coronavirus and end this pandemic.